Hello, everyone, and welcome to the Untold. We have another exciting edition of the Untold. How are you, Hadeel?
I'm good. Another exciting edition.
Yeah.
Today we're going to be talking about, we're going to combine medical,
Uh-huh.
medical field with therapy.
Well, that's still the medical field, though.
I mean, no. We're going to talk about...
We're mixing psych with family medicine.
Okay, family
right?
medicine. Yeah, we're going to talk about two medical aspects when it comes to, taking medicine and going to family doctor.
And we have a very interesting personality.
Yes.
He's quite passionate about what he has to say. He's very energetic. So let's not waste any time and welcome our guest.
Right after the break. So we're back again with our guest and Dr. Abdullah Alkhanfar. Welcome to the show.
Thank you for having me. I'm a pleasure to be here.
So let's start with a basic question. Introduce yourself.
So I'm Dr. Abdullah Alkhanfar. I graduated from Jordan University. I am a medical doctor. Graduated in 2020, COVID times.
All right. We graduated both in 2020. Great.
Cool. That's something in common.
That's something in common.
I chose medicine. So I come from a family of physicians.
All right.
My grandfather is the first Kuwaiti to specialize in radiology, Hadeel Al-Khalifa.
Nice.
So he's one of the
Mashallah.
first Kuwaitis to be in the medical department. He worked in the American hospital with Dr. Skedder, which is he's well known, and his wife. And yep, that's about it.
How about we get into aspects of family medicine that drew you into this specialty?
So let's go further like past that. Why medicine exactly? So prior to getting into medical school, I was in dentistry for 2 years, and throughout dentistry school, I decided to change my major into medicine. So I would love to say like medicine chose me. I didn't choose medicine.
We've heard that
It's
before.
like, always
But
medicine
it's
chooses
funny
us.
because he didn't say my parents chose it.
Oh no! even though I come from a family
Yeah.
of medical doctors, it wasn't like that pressured on me.
You could have been anything you wanted.
Exactly.
Okay.
So
I think it's just his genetics.
it is. It is from my grandfather's side.
Yeah.
So the decision of me changing my major was like a pivotal moment in my life. So let's say I was in dentistry school for 2 years, and I woke up one day and I was like, you know what? I'm gonna change my major due to like certain events that happened in my life. Let's say 8 years ago. So I was walking down the streets, and an ambulance was dropping a patient from the hospital toward his home. He was like this obese patient who had COPD, which is chronic constructive pulmonary diseases, which is some sort of a, it's in comparison with asthmatic diseases. So the patient was obese. He had only an elderly wife. She couldn't help him transfer. The paramedic couldn't help transferring the patient from the ambulance to his home. And I was walking down the lane, and I was like, okay, do you guys need help? So I helped this guy and the paramedics to exchange the patient to his home. And the guy was like, are you a doctor? And I'm like, no, I'm a dentist. No, I'm a dentist. And I was like, you need to be like a doctor. Why don't you choose being medicine? And since then I was like, okay, I'm changing my major. It's a sign.
It's a sign.
It is a universal sign.
So it's a sign. Now
I guess so, yeah.
Yeah, let's talk about family medicine. It often faces certain stigmas.
Yep.
How would you describe or address the misconceptions of stereotypes associated with family medicine?
So family medicine changed throughout the years, let's say throughout the 10, 20 years ago. Family medicine nowadays deals with different type of diseases, whether it's chronic diseases such as hypertension, diabetes, or arthritis, which is autoimmune diseases also. And we also have psychiatric departments, or let's say psychiatric clinics. We deal with different type of psychiatric diseases such as generalized anxiety disorders, depression, phobias in general. And we also deal with the common well-known diseases such as common flu, common colds, pharyngitis, which are sore throats. And dealing with family medicine, it is like different from any other specialties because we built like a deeper connection with the patient himself. So for example, let's say the patient takes 2 rows to treat his symptoms. Let's say he has a headache and he chooses to go to the emergency department or the family medicine department, which is the polyclinic in each area in Kuwait. So the headache will be investigated systematically from each side, whether it's family medicine or the emergency department. But on our side, we would take the extra run. We will ask some personal questions when it comes to his headache. So, what happened with you today? Are you stressful? Were you subjected to inconvenience? Did you had any sadness or any grief did you experience throughout the week? So, even though it's just a headache as a symptom.
Right.
So, us comparing to other doctors, we have the privilege to build a deeper connection with patients.
Okay.
Let's talk about trauma.
Yep.
Could you define trauma and how it affects our health?
So trauma as a definition is like a psychic injury or like an inner injury that happens to the person that affects his social encounters, affects our culture in different kind of ways. It affects our parenting, our education, our economics, also in our politics. So trauma by definition is like a constriction of self. It holds yourself, or let's say it holds the person to express his authentic self. And it's lodged in our nervous system, mind and body, past the originating, let's say, situation that inflated that trauma.
Okay, can you share some examples of what we call traumatic? In your opinion, what qualifies as trauma?
So what qualifies as trauma? We can say like it's not trauma if. So it's not trauma if it does not suppress your emotions. It's not trauma if it does not separate you from your body. Some people do have these feelings of being out of their bodies or out of their, like, let's say, surroundings. So we call it alienation or loneliness.
What
Sometimes
about
we call it.
derealization?
Exactly. It's the same definition. It's the same definition.
I think it's
so.
okay.
It is some sort of psychiatric problems. We do deal with it, but the stem problem comes from traumatic events that happen to the person for him to feel that way or to feel such way. So what's not trauma? Let's say if you cannot express yourself authentically. Some people do put a persona, which is a fake personality, to deal with society.
That leads to depression, right?
Sorry?
It would lead to depression, to suppress
It will lead to several type of diseases, whether it's depression, also chronic diseases, also autoimmune diseases, not just depression. So when we deal with the trauma, we deal with the different aspects of diseases in the future, whether the trauma happened in your childhood, whether it happened in your teenage life. The later on effect will be on several type of a way, whether it's like psychiatric, physical, physiological, and so on.
So when we talk about trauma, how does it manifest in us? And how does it affect us physically and mentally?
So trauma has, as I said, trauma has a several kind of effect on the person. So for example, let's take for a nice person, or we call it the nice profile, which is a person who sacrifices himself, who sacrifices his needs to please everyone around him, to please his surroundings, someone who's empathic, People pleaser, exactly. We call him the profile of a nice person. So what would happen to this person? He will sacrifice himself, his authentic self, and detach from his, let's say, authenticity, and that is some sort of like trauma trigger to him, or
Guilty.
you're guilty of that.
Guilty of trying to please people. Okay.
In comparison, let's say that we have like a man who suppresses his emotions. You know, there's a stigma around men that they cannot be vulnerable, they cannot cry, they cannot express themselves,
Which is wrong.
which is wrong, absolutely wrong. So later on, studies has shown that men that suppresses them anger because of traumatic events will lead them to prostate cancer. In comparison, also women, let's say a nice woman that sacrifices herself, wants to be in rescue, always in charge, always want to do her things without the help of others, also that gives her the risk of having autoimmune diseases such as ALS, or which is an autoimmune disease. Affects the it affects the nerve cells of the brain and the spinal cord. And MS also, which is multiple sclerosis, also an autoimmune disease that attacks the body itself. Also, these are also all stem from all stem from traumatic events.
What would you say medical conditions that would be examples?
Examples, let's say, as I put as an example for the people pleaser or the nice person, most of them will have autoimmune diseases, chronic diseases such as hypertension, which is high blood pressure. Also, insulin resistance, which is diabetes, also would be a cause of traumatic events. Yep.
I mean,
let's take, for example, a pregnant lady. Let's take, for example, a pregnant lady in her pregnancy period, and she was subjected to trauma. That event also, studies showed that the traumatic lady will affect the infant in her body. sorry, in her
womb,
in her womb. So he will be subjected to insulin resistance, which is diabetes. Later on, he will be subjected to a higher BMI, which is body mass index. Also, will have difficulty in his language later on when he develops.
So our parents are right when it comes to, you know.
So we need to create a surrounding, let's say a peaceful surrounding around the pregnant lady, because it will affect the child, because there is a connection between the child and the pregnant lady also. The woman.
Can it affect the child genetically speaking?
If there is like hereditary diseases, for sure, but we're talking about physiologic diseases. We're talking about what later on events that would happen if the child if the mother was traumatized during the period of pregnancy.
What kind of diseases do we expect?
We can expect asthma diseases. We can expect autoimmune diseases, chronic diseases later on, especially hypertension.
Just for being stressful.
From a stressed mother. From a stress mother, because we call it the HPA axis, which is the hypothalamus, pituitary, and adrenal glands. It is connected between the mother and the child.
But there's a trick here. I mean, during that pregnancy, the mom or the pregnant woman is always because of her hormones. She's always stressed. It's hormones, but isn't that gonna be hard to control your surroundings and your hormones?
That's why we believe that building a safer connection, building a safer environment for the pregnant woman, or let's say a less traumatic environment for the pregnant lady, will help the development of the baby later on.
I mean, for some reason I have so many questions when it comes to, because I never thought just because being stressful as a mom, you would be.
Now is the time to ask him any question you have.
I mean, I'm not going to be a mom soon, but I have a cat. Does that count? Do cats count?
But trauma has various kind of effect. Mm-hmm. Let's say the woman also was traumatized in her life, regardless if she was pregnant or not. Later on, that will contribute in her having ovarian cancer also. Women have three times the risk of having autoimmune disease just because she was traumatized in her childhood, or she was traumatized in her teenage life.
Okay.
Let's put simpler aspects of trauma in our daily life. You can be bullied in your school. You can be neglected when you were a child by your parents. Maybe you had a sick parent. Maybe you had a psychological problem when it comes to your parent. All these will lead to neglect and will lead to traumatic events for the patients later on.
What about the other way around? What if you're sick? Can a peaceful environment help you recover, faster?
A peaceful environment, let's say a culture in general. So today we have a problem when it comes to our culture, which is a materialistic culture. Absolutely. So what does a normal human being need? He needs belonging. He needs to have a good sense of self without the dependence of achievements. We need someone to be authentic, to be attached to his surroundings, not to feel lonely or to feel alienated with the surroundings. So all these aspects, which are all well known in our communities back then, helped in dealing with various kind of diseases or various kind of problems. Let's say you have a good supporting group. You will reach them, or you will reach for them to ask for opinions, to ask for them to help you out in your difficulties, and that will help. Let's say boost your immune system. That you have a supporting surrounding that will help you on later on.
All right. Well, I think it's a good time to have a break.
Yep.
All right.
And we'll be right back.
We'll be right back.
After the break. So we're back again with our guest, Doctor. We were talking about pregnancy. We were talking about a lot of things. But now I want to talk about, toxicity in the medicine field. Oh. What are some common sources of toxicity, and how can it affect healthcare professionals and patients?
So as you guys know, being in medical school as a student, or maybe you're doing your residency program as a medical resident, or you're doing your fellowship, we're subjected to a lot of pressure, whether it's burnout, whether it's the pressure of getting these all different type of knowledge and putting it in your mind and memorize it and practicing it. And
you guys have long hours too.
And we do have long hours of practicing, especially if it's a clinic, if it's at a hospital or the emergency department, you name it. So these type of pressure on the medical doctor will leave him to have a, let's say, a superficial interaction with his patients, or more so, let's say, a systematic approach to his patients. He wouldn't be able to like build a deeper connection with them, or asking them like deeper questions when it comes to their diseases. So nowadays we only let's say obsess over the diagnosis. What's my diagnosis? What is this? Why am I having these symptoms? What am I having these signs? But no one do ask about the history of the patients. Why did you have this disease in the first place? Is it only hereditary? Did you have like a backstory? Most of diseases, most of diseases have this sort of like story comes to them.
Right.
So maybe I was subjected to stress for 2 years, and later on I'm started to developing these symptoms, body aches. I have one of my patients that used to have body aches for 2 years, and we've all thought that he had rheumatism. He traveled across the seas and came back with no signs of any rheumatism. In fact, when we investigated deeply, he had psychological problems such as stress. So the patient was a manager in a cooperation, and he's in a constant stress. He couldn't sleep for 2 years. I'm always worrying about the money. I'm always worrying about my establishment. And we didn't know that in the beginning. So let's say taking the extra mile to ask these deeper questions when dealing with patients will help us as a physicians nowadays to build a deeper connection with.
What would you say are those questions to ask?
So one of the most important questions, are you familiar with childhood trauma? This is one of the questions that we need to ask. Were you traumatized in your childhood?
Which our culture is like not very open about.
Not very open about it,
about.
but we are raising awareness towards that kind of let's say approach when it comes to dealing with diseases. So one of the questions we can ask, what is the degree of loneliness you have? Are you lonely? Do you have like your peers? Is there like any inner connection with them? Is there any depth when it comes to your connections? How is your relationship with your spouse? One of the patients that we had, she had a relationship with a narcissistic personality disorder, constant stress. So she came to the clinics with having, let's say, overweight problems, and we thought she had like some thyroid problems. Later on, when we dig deep, she had a constant stress related to her relationships.
So I love how you just mentioned that, you know, your surrounding, your people can affect your health.
Yep, exactly. Your people
Good
can affect
point.
your health,
The
your
environment
relationship
you're
with
in.
yourself.
I need to filter the people in my life.
Not just filter them. You need to know how to deal with these people. We cannot filter everybody. Let's say your toxic people are your family. Maybe you have a toxic mother. Maybe you have a toxic father. You cannot and we do
It happens.
It happens, and we do have these like examples in our societies nowadays, whether we want to admit it or not.
Stressful homes, yeah.
Exactly. So most of the patients we see, some of them have abusive parents. They use, or let's say abusive partners.
Right.
Maybe we have
stories, yeah.
So we have this type of violence that happens in our homes nowadays, and we need to be like aware of it. Maybe it is the cause of your disease, not something systematic. Maybe it is psychological that's causing you symptoms nowadays.
I think it's easier for people to ask for a pill to cure it.
Exactly, which is the fast approach to go for a doctor and take the pill and you're cured. So there is a huge difference between.
Most of the time you don't actually get cured. And just
exactly. So there's a
happening.
difference between cure and heal. So I can, as a medical doctor, give you a medication for your disease and you're cured, voila.
Right.
But when it comes to healing, maybe you're cured, but you're still stressed. You're still thinking about what happened to you. You're still thinking about what happened in your past.
So you're basically saying that, you know, medical doctors and therapists should
Need to get intertwined. And they need to raise awareness on how to approach people nowadays, because it's different. It's not like let's say let's divide the years post-COVID and prior to COVID. So
why do you think that's a good time?
Exactly.
we stayed home for too long.
Exactly, and the quarantine itself, it was the most, let's say, frustrating and positive thing that happened to us. So it helped people to reflect on themselves. So it helped people get back to themselves, know themselves on a deeper level. So when they came back again to society,
it also caused a lot of people to get anxieties and
exactly.
depressions and
For
fears.
sure.
They created new
fears, phobias. They have anxieties towards us physicians.
I remember going out for the first time after being in the lockdown for a while. I was like, why is everything so like big? Well, what's happening? The streets look so long. Like, why is this mall so
because
huge?
she was constricted in her home for like 2 years, and she's like, now, oh my God, I'm free.
I went to the mall. I went to the mall. Like, why is this? Am I gonna have to walk all of this?
I'm so glad I didn't experience a true lockdown.
Exactly.
I did.
I was in COVID wards as well, so I didn't experience like a legit close down. But it was a horrific times for sure. It was a stressful times for everybody, us physicians and citizens. And let's say we can continue on the questions. We can ask for or the doctor can ask for their patients, how's your relationship with your spouse? How's your relationship with your bosses also? So we have toxic environments. Yes.
I don't think anyone has a really good relationship with their boss.
Wouldn't a question about spirituality even factor in?
Do you have a spiritual practice? Do you have like a strong belief? Whether we want to admit it or not, having a spiritual practice, whether it's praying, fasting, contributing to the community, this will help the stability of the patient, whether it's like mentally, emotionally, or like physically also, and so on.
That's why you'll notice some people are like, they're like 70 or 80 and they look so young because they are.
And when we ask them, how do you like obtain such a healthy lifestyle? What do you guys do? So we have a healthy community. We have a healthy environment. We have my spouse.
Reading.
Sorry?
Reading or
not just reading,
like
raising their awareness, raising their consciousness. They read about different type of aspects. They're not lodged in some period of time and then they aged on it. So that sort of like practice daily day will help in achieving a healthy lifestyle later on. Stress of work.
Everyone has work stress,
but are you dealing with it? That's the question.
Is very non-stressful.
Everybody has stress. Everybody has stress related to problems, but are you dealing with it?
Are you dealing with it?
How are you dealing with it?
Is ignoring stress a problem?
Stress eating.
Acknowledge let's say it's the start of the healing.
Okay.
Acknowledging the problem is
acknowledging some people go for stress eating or excessive workouts,
which is what happened in our culture today. So because of the materialistic culture we obtain, this led people to like seek different type of adaptation methods. Let's say addiction, workaholism, addiction. Having their like workaholics mostly. Workaholics.
Would you say being a workaholic is a bad thing?
It is.
It is?
Yes.
Why?
Being workaholic, it is. So this constant thinking of doing your job 24/7 without even taking rest. You have a human body at the end of the day. You're not a robot, so you need your resting days. And I encourage people to have some resting days. We do not want burned out.
That's a lifestyle.
Can you be a healthy workaholic?
In some sort of a degree. I don't think there's like healthiness when it comes to a workaholic. Because are you escaping something? I would ask the patient, are you escaping something?
Are you missing family time, friends time?
Exactly, because no workaholic will come to you and tells you, I have a beautiful life. Maybe you have a beautiful workspace. Maybe you have a beautiful work life. But when it comes to his emotional life or social life, it's catastrophic. So what are you, this sort of escapism you're using as work, which you say, I am a workaholic, I cannot.
So it's a good thing to have a balance.
Exactly.
It's very good.
So balance is something like we encourage.
Here's something off the script. How do you balance your time?
So balancing my time, it depends on my work first of all. So do I have like this week, maybe I have like let's say 3 shifts, or I have 2 shifts. I need to like work around it. Am I finding a time for myself? Am I finding a time for the patients, for my family? So these type of things needs to be like at least calculated.
So time management.
Time management is so important when it comes to dealing with your work.
I want to talk about it from a cultural,
aspect.
Yeah. Okay. Is there any cultural, let's say norms or practices that can affect our health?
In such way? In what way exactly?
Maybe eating habits, I don't know.
Or like in
So first of all, we can say, let's acknowledge what are the toxic things that happening in our culture nowadays. So the toxic things is materialism. So materialism will cause the person to let's say have some sort of side effects. So what are the side effects? Alienation, loneliness, detachment from your authentic self. Exactly. Detachment from your authentic self. So when we want to start practicing something healthy to obtain a healthy culture, let's start with being authentic. So are you willing to be authentic and leave that fake persona at home?
Some people are afraid to express their authentic
self. And that fear stem from trauma. So that fear itself stems from a toxic culture. So when we raise awareness regarding these issues, we will help obtain like a healthy culture, as we said.
Off script, I have one question.
Sure.
How common is trauma nowadays?
It is so common.
Very common.
It is so common. It is scary common.
So the question here, do you think trauma is a trend nowadays?
So it's not a trend in comparison to, like, let's say people are aware nowadays.
Right.
So people started reading these healthy books, these self-development books, these psychological books. People started to like know better about their lives. They're integrated their, like, let's say, psyche. When it comes to integrating the psyche, they know that they have a persona, which is the fake mask you wear in the culture. You have an ego. Is it healthy or is it toxic? You have deeper. You're like a single person in this huge universe. You need to encounter yourself in a deeper way. So it's not trendy as in much, and the awareness is different nowadays. Our generation is more aware than the older generation. Older generation, let's say, they were in like survival mode because most of them came from wars, like it happened in Kuwait in 1990. But us children nowadays, or us people nowadays, are dealing with trauma in a different kind of approach. We're not just in a survival mode. We want to sit with it. We want to feel it. We want to encounter it. Can I heal this? Can I move forward from it? I don't want to be stuck on the same place in regard to this trauma. So it's not a trend, as we say, and it's not just a trend.
Awareness.
It's more like awareness, the awareness of the, let's say, the collective
People
awareness.
taking it more seriously now.
Yes, and the collective awareness is in an increment rate nowadays, as you can see in what's happening in Palestine and Israel. Now everybody is like aware with the occupation that's going on. So this is, let's say, a sign of an increment in the awareness.
All right. So, are there any pathways that can ease living in a toxic culture?
Yes.
First of all, do you think we live in a toxic culture?
We do, but I don't think most of people are aware of it.
Okay.
So, from a medical aspect, because we see that in our clinics, we can see that a person, he's so stressed because of his family members, because of his spouse. So, my approach would be like, are you willing to express your authentic self? Are you willing to build like deeper connection with your peers? This is one of the things that we can use. Second of hand, can you be like able to take responsibility for your actions? Nowadays, people, they cannot, we call it the agency. Can you be able to take responsibility of your actions toward yourself, toward others? Any sort of like incapability of taking actions, this is some sort of trauma. So why can't you take, let's say, responsibility for the things you say, the things you do? We need to investigate that. More often, can you deal with anger? Can you express your anger in a healthy way? Anger management, we can simplify it in one word: healthy boundaries. Do you have healthy boundaries at work? Do you have healthy boundaries when it comes to your relationships? Do you have healthy boundaries with yourself? Or are you sacrificing yourself just so on everybody would like you? And later on, acceptance. Can you accept what's going on in your life? Can you have this, let's say, authentic acceptance?
Sounds like the stages of, I don't know, grieving.
It is. Exactly. It is. But it's like compared to, and we can add some extra things, which is compassion. Which is adding compassion to these elements will help establish, let's say, a healthy pathway for the patients or any individual in this society.
All right, Dr. Abdullah, we've had a beautiful episode with you. Thank you for spreading awareness on traumatic experiences and how to handle traumas in life.
Thank you guys for having me. It was a pleasure to be here.
All right, so we'll be back for the wrap-up.
Wow.
Interesting personality.
He has so much knowledge, you know?
I mean, I
feel like one episode was not enough.
True.
And I'm going to have a conversation with him about some certain things and aspects of my life.
In your life?
In my life, yeah.
Maybe I should
need to seek help, professional help sometimes.
Anyway, we need to end
this episode. Sorry.
Don't drop your
cup.
water.
Sorry, cup. And we'll see you next time.
Good night.